want to go now to a map we put out every Wednesday, put out yesterday, and that is the travel advisory. And this is the map that we put up, and something different has happened this week. As you remember, we warn people about any state that's above 15% positivity. Now we are one of those states that we've been warning people about. So Ohio is now at 15% positivity, and that number has been going up. Just continues to go up. Our travel advisory says this from yesterday, that was what was posted. This is the first week since April where Ohio's positivity for COVID-19 has increased above 15%. The state has seen record levels of cases, deaths, and hospitalizations in the past week, and all Ohioans can help to limit the spread and impact of this virus. This includes recommendations to stay at home, except for necessary trips for supplies, consistent mask wearing when around others, and frequent hand washing. So this includes stay at home except for necessary trips for supplies, consistent mask wearing when around others, and frequent hand washing. Together, we can help stop the spread of COVID-19. That's what we posted yesterday, and I think that's pretty much exactly what Dr. Colburn had to say. As you can see from this map, really for the first time, if you look at our neighboring states, we, with the exception of Pennsylvania, our neighboring states, West Virginia, Kentucky, Indiana, Michigan, all are doing better than we are as far as the positivity number. And ours continues to go up. I want to bring on now Dr. Bruce Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. He's with us today. We'll talk a little bit about Ohio's positivity rate and kind of maybe explain the significance of the positivity rate, because I think, Doctor, that's one of the things that I had no idea before we went into this pandemic what in the world that even meant. And I suspect we have people who, you know, kind of wondered, well, what really does that mean, and what's the significance?
Thank you, Governor. Well, you know, you're absolutely right. Our moving for the first time since April to a positivity rate above 15% is really bad news. Rates between 10 to 15% have been described by some people as the equivalent of being in the midst of a very bad thunderstorm. And rising above 15% is being in a tornado. Ohio is in a tornado. Now, not surprisingly, that tornado is associated with some of the numbers you've shared and that my colleagues have highlighted. We've got record numbers of cases, of deaths, of hospitalizations. And the rising hospitalizations, as they've both referenced, should really worry every Ohioan. It means that our doctors and nurses are facing very difficult questions. Questions like, are there enough beds left at your hospital? Or will you have to move to another hospital, or perhaps even another community? How long will your surgery have to wait, as Dr. Coburn referenced? Now, Governor, I don't think this should cause Ohioans to despair, but it's a wake-up call, and it should be a call to action. Lots of medical research and our own experience as Ohioans reminds us that we really can work together to limit the spread and impact of this virus. And again, as Dr. Coburn said, we've done it before. Remember, this virus spreads from me to you when we're near each other. For a little while, we need to stay apart. And that really means that we have to stay home, except when it's necessary for trips for supplies or going to work. And when we must go out, I want to underline what Dr. Coburn said, we have to wear a mask every time, all the time. Together, Governor, I know we can slow this thing down until the amazing vaccines that are headed our way pull us out, but we've got a lot of work to accomplish together.
Doctor, thank you. Thanks for joining us.